Welcome to today's lesson on nasal valve collapse. We will explore the anatomy, physiology, diagnosis, and treatment of this condition. We'll also discuss the challenges and management options for patients with other nasal conditions. Lastly, we'll touch upon emerging research and innovative treatment approaches. Let's begin. The nasal valve region is crucial for regulating airflow in the nose. It consists of the external and internal nasal valves, which control anterior-posterior airflow and resistance. Understanding this anatomy helps diagnose and treat nasal valve collapse effectively. Nasal valve collapse can be caused by a variety of factors, and a thorough understanding of its etiology and associated risk factors is crucial for effective management. Trauma, both acute and chronic, is a common cause of nasal valve collapse. However, aging can also contribute to weakened nasal structures and subsequent collapse. Congenital abnormalities, such as a narrow nasal valve angle or weak cartilaginous support, can increase the likelihood of nasal valve collapse. Furthermore, previous nasal surgeries, particularly septoplasty or rhinoplasty, can lead to altered nasal anatomy and compromise the integrity of the nasal valve. Other contributing factors to nasal valve collapse include chronic nasal inflammation, allergic rhinitis, nasal polyposis, and chronic rhinosinusitis. The interplay between these factors can further exacerbate nasal obstruction and compromise nasal airflow. Identifying and understanding the underlying etiology and risk factors associated with nasal valve collapse is vital for tailoring the treatment approach to each individual patient. It allows for comprehensive management and optimal outcomes. In patients with nasal valve collapse, typical symptoms include nasal obstruction, difficulty breathing, congestion, and airflow disturbances. Physical signs may include inward collapse of the nasal sidewall, pinched nostrils, or the inverted V deformity. Recognizing these signs aids in accurate diagnosis and treatment planning. Various techniques can be used to diagnose and evaluate nasal valve collapse. These include anterior rhinoscopy, acoustic rhinometry, nasal endoscopy, and computed tomography, CT, scan. These methods help identify structural abnormalities and assess the severity of the condition. To establish a standardized approach to nasal valve collapse, various classification systems and grading scales have been developed. These systems aim to categorize and grade the severity of nasal valve collapse based on clinical findings, subjective symptoms, and objective measurements. One commonly used classification system is based on the site of collapse, distinguishing between internal and external nasal valve collapse. This classification helps guide treatment decisions, as the management approach may vary depending on the location of the collapse. Numerous grading scales are also available to assess the severity of nasal valve collapse. These grading systems often take into account subjective symptoms, objective measurements such as nasal airflow resistance, and anatomical findings observed during physical examination or endoscopy. By utilizing standardized classification systems and grading scales, clinicians can effectively communicate the severity of nasal valve collapse, compare treatment outcomes, and guide surgical decision-making. This allows for improved consistency and collaboration among healthcare professionals in managing nasal valve collapse. The treatment of internal nasal valve collapse includes both non-surgical interventions, like nasal saline irrigations and nasal dilators, and surgical options, such as septoplasty, spreader grafts, and functional rhinoplasty techniques. The choice of treatment depends on the severity of the collapse and patient preferences. In the video, we discuss various treatment options for external nasal valve collapse. Non-surgical options include adhesive strips and nasal cones, while surgical interventions like external nasal splints, suturing techniques, or alar rim grafts may be necessary in severe cases. Treatment is personalized based on the patient's condition and preferences. In revision surgery for failed nasal valve reconstruction, a careful evaluation of the underlying cause is crucial. Additional grafts, scar revision, and septoplasty may be necessary. Tailoring the approach to address challenges improves patient satisfaction. Nasal valve collapse commonly coexists with septal deviation. This interplay can affect rhinoplasty outcomes. An integrated approach is needed, including preoperative assessment and surgical interventions, to address both conditions and optimize results while minimizing complications. Patients with coexisting nasal valve collapse and chronic inflammatory conditions, like nasal polyps or chronic rhinosinusitis, face unique challenges in their treatment. A multidisciplinary approach involving otolaryngologists and allergists is often necessary, along with medical management and surgical interventions, to improve outcomes. In the video about nasal valve collapse, we will discuss the potential complications and risks that can occur with both non-surgical and surgical treatments. It is important to understand these risks to ensure optimal patient care. Research and advancements in nasal valve collapse include computer simulations, bioengineered graft materials, and minimally invasive techniques. These developments improve understanding, diagnostics, and treatment options, resulting in better outcomes for patients. Medical professionals should stay updated on these advancements to provide the best care management. It is important for medical professionals to stay updated on the latest research and techniques to provide optimal care for patients with nasal valve collapse.